Hi. Um, I just had carpal tunnel surgery release, the open procedure, not the endoscopic procedure. I just had that done yesterday. And the reason why I'm making this video is because as I was researching and reading stuff on the internet, I would like to hear what other people have gone through. And there was one video that I found from a lady that had the endoscopic procedure. She actually had both hands done. And so I kind of wanted to share with whoever cares out there my experience. I did some research online. I was experiencing numbness and tingling in my hand probably for a year now. I do a lot of crocheting and knitting, and last year I kind of started a business. I didn't intend to start a business, but I made some hats for some people, and it just went off from there. They were actually the Minion hats from Despicable Me. And last winter, I probably made over 100 hats plus scarves and other things that people asked me to make. So as a result, I ended up getting really bad carpal tunnel in my hands. I first started just get numbness and tingling, and then it went to waking me up at night where my hand just, it felt like it was burning. I don't even know how to describe the sensation. It's kind of like a really bad cramp that you get, and I couldn't figure out or do anything to get rid of it. And so one day, let me back up. I had a hip replacement earlier this year, and so I was in to see my doctor for a follow-up, and I had my brace on. I started wearing a brace at night to sleep, and then when I was working on my crocheting, and my doctor said, you know, well, why are you wearing that brace? And I told him, and he said, I can fix that for you. And I said, okay, yeah, let's do this. And so he gave me a prescription or an order to have my hand tested. And what they did was they did a nerve conduction test to see, they measure the response of your nerves. Basically what they do is they shock your hand in a couple of, it doesn't hurt, they shock your hand in a couple of different places, and they measure the response of your fingers. And so they did both hands, and my right hand, which is my dominant hand, came back pretty severe, and my left hand came back needing the surgery, but not as severe. The doctor that did the test said if I was to envision my nerve as an insulated wire, he said about 75% of my insulation was missing from this hand, and some of the wires that go to the fingers were not working. On my left hand, he said 50% was not working. And he said if I gave this hand a rest for about 2 years, I could probably get back to normal. Now, this one doesn't feel so bad during the day. It's at night where it bothers me the most. But this one was getting intolerable. He also told me that the more I worked my hand throughout the day, the worse it was going to be at night. And that was the truth, because I tried to rest my hand, and then a couple of days I would work on needlework, and then that night I would pay for it. And so I called my doctor and I said, okay, what's next? He said, carpal tunnel release. I said, let's schedule it. I didn't even ask him what kind of procedure. I was hoping he was doing endoscopic. We scheduled it, and he ends up doing the open procedure, but the incision, from what he told me, was tiny. It was like not even 3/4 of an inch, so it's not even a real big incision. This is the hand, and it was just like right here. The incision is right here on the palm of my hand, just below, just above the wrist. Endoscopic, they cut across at the wrist, and they use a camera to go in and make the cut. Anyway, so I scheduled my surgery, and that was yesterday. I was the first one on the schedule. So I was there 6 o'clock in the morning. I couldn't eat anything from midnight the night before. My surgery was scheduled for 7:30. So they took me in a couple minutes after 7:30, wheeled me into the operating room, and they were setting me up. And the next thing I know, I'm in recovery. They had told me it was 10, 15-minute surgery, and I don't know what time it was when I woke up, but I know that by 9 o'clock I was ready to go home. And pain level was not bad at all. I was really surprised because I thought maybe my hand would be numb. The lady that I watched in the video, she said her right hand was very numb the first day, so I thought maybe I wouldn't have movement or anything in my hand, but I could move it. And it's one of the things they say is move it and just rotate it. They gave me Vicodin for pain meds, which I didn't take yesterday all day when I was home. I couldn't believe how well I felt. And I didn't sleep the night before. I was just tossing and turning. So I went to bed, and I did take some Vicodin when I went to bed because I thought, I don't know how this is going to go. So I took some. It didn't really do anything for me, but I really didn't have any pain when I slept. I didn't sleep last night either. Just could not fall asleep. I don't know what they put in my IV, but I couldn't fall asleep. This morning it is sore. This morning it does hurt some. But I just took, well, I'm going to take 2 Vicodin after I have my breakfast to see if it helps. I could take, with the Vicodin, I could take some Motrin. So if the pain doesn't, like if I don't feel it goes away, I can take some Motrin. They also said to ice it for 20 minutes every couple hours. So I may try that too before I do the Motrin. Let's see. I gave you my background. Oh, the next few days, they said I could take the dressing off. There's a ace bandage around my hand. They said I could take the dressing off in 2 to 3 days. So on Saturday, I'll take that off. But then I'm supposed to put a Band-Aid on it and then put the ace bandage back on. I'm assuming it's to just kind of help support the arm and not move it too much, not jostle it too much. I'm sorry, the wrist. And in 5 days, I could take the bandage off. To call and make an appointment for a follow-up for next week. Can't get it wet, so when I take my shower, I'm going to wrap it up in a plastic bag and tape it up so I can take my shower because I need one. And it really hasn't been bad. I am pleasantly surprised as to how well I feel, and that I can use it some. I can use it to like just kind of pinch stuff. I can't do anything heavy. One of the instructions was nothing over 2 pounds. So they encourage you to use it, but limit it. So I won't be doing any knitting or crocheting anytime soon, which I'm itching to do. But yeah, I think that's about it. I am going to get the left one done. They told me in a couple of weeks. Actually, what they told me was when I go for my post-op, I should get 1 day of physical therapy to show me what exercises to do, and then we'll schedule the next hand. So I'm not really sure how long he's going to make me wait before we do the next one. So I'm hoping it's not too long. I have some orders for hats that are waiting. I have time for those because winter time, and these are for Halloween. I have some time. So I really want to get working on those. And if you're curious about my hats or the things that I make, I have a Facebook page called Creating Smiles One Stitch at a Time, because that's the reason why I do it. I really enjoy, it's very therapeutic for me, and I enjoy bringing smiles to people's face. I don't have prices on anything because I'm very, very reasonable, and I kind of just like to talk to the people, and we'll determine a price and figure out the details. So anyway, I thought I would share with you my experience with carpal tunnel release surgery, the open procedure. So far so good. I'm glad I had it done. Hopefully I will get full function in my hands, and if I could just do away with the pain at night and I have to tolerate a little bit of numbness and tingling on my fingertips, I can tolerate that. It was the pain at night, and what would happen when I would be crocheting, my hands would get really numb. So I'm hoping that that doesn't happen. Obviously, I have to go a little lighter with that and not work as hard, making so many hats and rushing through stuff, giving my hands a break. I figured it couldn't be any worse if I didn't do it. I know that carpal tunnel is not guaranteed, the surgery is not guaranteed to take care of the problem. But I figured if I didn't try, I wasn't going to know. And if it gives me, if I still have slight symptoms, it's better than what I was experiencing. So hopefully, you know, we'll get good results. I chose this doctor because he was the doctor that did my hip, and so I didn't have any issues. I really just had confidence in him that he knew what he was doing. And yeah, so hopefully if you're considering having carpal tunnel surgery, this little video helped you hear from my side what the deal was, and I'll keep you posted on my progress. And if you like this video, press the like button, and look for me maybe in another week, and I'll post, you know, what's going on then. Thanks for watching.